Opie is taking us through global citizenship and telecommunications in the context of healthcare access, sub-Saharan Africa. Take it away.
So, hello everyone. My name's Opie, and my presentation will be focused on communications technology and global citizenship, and how both of these play a role within the context of healthcare access. And more specifically, I'll be focusing on sub-Saharan Africa. And at some point in the presentation, I'll also briefly talk about some of my own experiences in Tanzania from a global citizenship perspective, and then I'll wrap it up by showing a few larger projects for the tech industry in Africa. So for background purposes, we all know healthcare is an important issue in an area such as sub-Saharan Africa, as many of these places suffer from lack of access to healthcare facilities. And just to show some statistics, the World Health Organization, they estimate that 69% of the world's HIV population resides in sub-Saharan Africa, and this region also accounts for 70% of all deaths from AIDS-related causes. I decided to look at HIV because, generally speaking, lack of healthcare and high rates of HIV, for the most part, are positively correlated. And if you look more closely at this region, the area just does not have enough doctors. Just to pull an example from Ethiopia, in 2010, the World Health Organization, they also estimated that in Ethiopia, the ratio of physicians to citizens was 1 physician for every 37,000 citizens. Furthermore, the UN Millennium Development Goals, so that's pretty much, those are pretty much 8 goals aimed with the intent of alleviating disease and poverty for humanity. They stated that medical personnel shortages in particular have been identified as one of the major impediments to achieving the health-related goals set out for the next decade. So with all of these statistics of shortages with doctors, nurses, staffs, you can say that the aid of global citizens to help alleviate some of these problems, they pretty much have huge hurdles to overcome. On the bright side, in the form of communication, but also stemming from a lack of fixed infrastructure, Africa's largest industry is the mobile industry. Furthermore, Africa is the second biggest mobile market in the world and is currently experiencing the fastest growth when compared to the rest of the world. If you look at this graph, you can see that the rate of cell phone and smartphone subscriptions are exponentially higher than fixed line subscriptions. Smartphones also hold more than 50% of internet connections in Africa, so like the developed world, there's a huge shift towards mobility there. But this makes sense, doesn't it? Cell phones are cheap, far cheaper than desktop computers, and they're relatively easy to use and understand. While most of the phones there are not smartphones, they still serve some beneficial purpose. And within sub-Saharan Africa, the total number of cell phones, I've discovered this through my research, the total number of cell phone subscribers is higher than those who have access to improved water sources, so things such as household plumbing, protected wells, and rainwater collection systems. So therefore, you have an area with the potential for huge telecommunications boom, but suffers from basic health problems such as access. It makes sense that problems of access can be improved by improving telecommunications. But who will help improve access? It seems like the growing mobile industry would make sustainable projects easier for global citizens. So then, let's for a moment look at what is the global citizen. I found 2 perspectives, in my opinion, that work well to define the term. On this slide is a quote from Thomas Friedman, who is the author of The World is Flat, which is a book that looks at globalization and the interconnectedness of society from a business standpoint. And in his book, he says, "The social entrepreneur is usually someone who burns with desire to make a positive social impact on the world, but believes that the best way of doing it is, as the saying goes, not by giving poor people a fish and feeding them for a day, but by teaching them to fish in hopes of feeding them for a lifetime." So while Friedman doesn't explicitly say the global citizen, I still think elements of global citizenship are apparent here when he talks about the social entrepreneur. And the analogy of the fish represents collaboration with sustainability being the end goal. Oxfam, on the other hand, represents a more refined definition of the term. Here they explicitly state global citizen, and if you focus on some of the last few points of the bullets listed, excuse me, the global citizen participates in the community at a range of levels, from the local to the global, and he or she is willing to act to make the world a more equitable and sustainable place. So if you notice, many of the points are in line with Friedman's idea of the social entrepreneur, and they both draw similarities in the sense that sustainability is the main concern of global citizenship, and usually this can be overcome through engaging the community. So as established earlier, lack of access to medical care is still a huge concern for everyone, including global citizens. If we look for tools a global citizen could use in terms of technology, I think one of the best tools we're all familiar with is the internet. And mainly, the internet is great because it can help alleviate problems of distance. So the World Health Organization defines e-health as the transfer of health resources and health care by electronic means. Technology is a subset of e-health, so often you'll see these two terms be fairly interchangeable. Both e-health and telemedicine measures, to be more specific, allow physicians to perform diagnosis, give recommendations, and treatment through remote access from anywhere in the world. To put it shortly, in the virtual sense, you can take a doctor to an area where there is no doctor. So for example, telemedicine would help when a villager is debating the opportunity cost of leaving their village versus receiving treatment. Without telemedicine, the villager would probably defer treatment and not receive a proper checkup if the physical distance is too great. And measures like teleradiology, teleophthalmology, they're all ways of accurately diagnosing diseases from a distance. However, one drawback of telemedicine is that if it's underdeveloped in an area that really needs healthcare, it loses quite a bit of effectiveness. Therefore, you have to find ways to engage the community on a more personal level. For those global citizens working within rural areas, engaging the community, the greatest tool at their disposal is probably their mobile phone. So I'd like to talk a bit about a project I was involved with last year. Pretty much today you have student-run groups and other volunteer groups coming from abroad and looking for ways to improve health in these communities. And as some of you may know, I was part of a student group that went to rural Tanzania for 10 weeks, and we worked on health projects in various communities. One of the projects more in line with the topic of telecommunications technology and medicine was our BioSand filtration project. So basically, we visited a village named Kikongo. It's in a rural area within the country of Tanzania, and we saw that they had high cases of diarrheal disease after consulting with their healthcare workers. And after that, we had many consultations with members in the community, and eventually we were able to find and contact a group called Serving Our Neighbors. And the significance of Serving Our Neighbors is that they manufactured and distributed BioSand filters based on technology from the University of Calgary. And these filters are very easy to use, and if you can see from the diagram, you basically pour water from the top, and then this would trickle down through the various layers of the system, and then after about 30 minutes, you would have collected about 20 liters of safe drinking water. So pretty much the system requires minimal maintenance and could be explained and demonstrated to a local villager without much difficulty. Furthermore, the program was a first-year pilot or a trial run, so it's still being monitored today, and we will be checking upon it next year in person. But there are a few main things I'd like to take away from the project. First, our group was able to cheaply acquire Nokia phones compatible with major networks in the area. Additionally, almost every villager within the community had the exact same phone despite not having electricity to charge them. But that wasn't a problem since you could go into town and charge your phone at mobile charging systems, which is a nice little business idea in my opinion, if you consider their circumstances. But with no major hurdles in the form of cell phone communication, we were able to introduce the community leaders to serving our neighbors, and they received their filters along with a few workshops based in Swahili on how to use them. And then an agreement was formed between serving our neighbors and the Kikongo community, which would allow them to purchase filters at a subsidized price in the future. If the Kikongo community members wanted, they now have the knowledge and means through their devices to contact the manufacturers and continue purchasing filters without our help. In terms of payment for the filters, the payments were made using the M-Pesa mobile banking system. As you may be familiar, M-Pesa, the M stands for mobile and Pesa means money in Swahili. M-Pesa allowed the community to compile credits onto one person's account in the village, and then that person made a lump sum payment to serving our neighbors for the filters. The system directly reduced the time it would need to go to an ATM, withdraw money, and then meet with the Sun employee and then hand him the money. So within a rural area and only through the use of a simple mobile phone, this is a huge deal. Another benefit of mobility is a simple technology referred to as SMS, which is the standard texting protocol available on all smartphones. This technology operates on a lower frequency, so it can overcome weak network signals where a regular phone call cannot, sorry. So you see systems such as SMS medication reminder systems where text messages are used to remind patients of appointments and when to take their medications. You also have Novartis, I don't know if I'm saying that right, SMS for Life, an initiative in sub-Saharan Africa that collects information by having regular cell phone users send text messages to a database, which then tracks malaria disease statistics and anti-malarial inventory levels in the hope of preventing outbreaks and medical shortages at healthcare facilities. So overall, you see that despite infrastructure inadequacies in these rural areas, they are overcome by creating innovative systems using the current existing technologies made available to them. You can see the impact of minor technologies such as M-Pesa and SMS text messaging for health improvement and health access within these areas. So while these infrastructure inadequacies exist, what's being done to help alleviate them? What's in store for the tech industry in Africa? And to be more specific, sub-Saharan Africa. So let's look at some tech giants in particular. So Google has announced 2 projects this year. Project Loon was announced earlier this year, and Project Link was announced as recent as last week. Project Loon hopes to provide internet access to rural areas in Africa by placing balloons into the stratosphere twice as high as airplanes and weather, and then these balloons will create an aerial wireless network around the world, which will be steered by rising or descending the balloons according to the speed of winds. Project Link is based in Uganda and will be expanding broadband access from Uganda to the rest of Africa. Project Link is an investment into fiber optics and can potentially help alleviate file transfer problems that take place within telemedicine. So overall, you have many projects. I've only looked at Google, but there are many others out there. Mark Zuckerberg is undertaking another connectivity project called internet.org, which is similar to Project Loon. But basically, these 2 projects by Google, they're hoping to reduce the technological divide between Africa and the rest of the world, and will likely help in improving health as well. And from the definition of global citizenship earlier, Google is engaging in communities at a range of levels, and they're helping with sustainability as well. But also, I think it's pretty obvious that Google expects to make a huge profit off their investments into these projects. So, why is connectivity important? A few weeks ago, Bill Gates was interviewed by CNBC, and he was specifically asked the this question of connectivity versus disease eradication. And Bill Gates responded with, take this malaria vaccine. Which is more important, connectivity or malaria vaccine? If you think connectivity is the key thing, that's great. I don't. So I agree with this statement to some point. Obviously, disease eradication is a noble cause, and if you ask most people, saving a life is a pretty big concern. I think everyone knows about the Bill and Melinda Gates Foundation. Bill Gates is a huge philanthropist, and recently he's been dead set on eradicating polio from the world. And it's actually getting pretty close to. I think they're at 99.9 something % right now, worldwide. But at the same time, back to telecommunications. While telecommunications does not directly cure disease like a malaria vaccine would, I would say it still has the means to empower those who use it effectively. If used effectively by responsible global citizens, it can definitely make a substantial change in medicine and healthcare within areas suffering from problems of access. And that's my presentation.
So, questions?
Oh, I need a Kleenex.
So I'm curious about who you need on the ground in order to perform the special services. So you might not need the doctor there to do the radiology, the remote radiology, but is there people on the ground to do those tests and get that data for the doctor?
When you say on the ground, where are you referring to?
So you're talking about doing a telemedicine, and you're also talking about doing teleradiology.
Okay. Telemedicine usually takes place within dense urban areas. Sometimes, because that's where all the technology is, right? In the rural areas, you don't really have all these computers or whatever. But if someone has a computer in a rural area with telemedicine, the patient wouldn't have to go to the urban center. They could go to the computer, and then they could collaborate with one another in terms of diagnostics. Obviously, it's not as good as face-to-face interaction, but it's still an improvement over having the person in like a rural villager going to urban center, not knowing if the doctor will be able to see them or.
Okay.
Yeah.
So 2 questions. First one is just following the previous one. So the tech radiology that the
teleradiology?
Yeah, teleradiology, just as I said. Is it like the Skype, like the patients in a remote area, they can Skype with doctors to see like
they can Skype?
Like the Skype.
They can Skype
with the doctors. You said in some area there is no doctors, so the patients don't need to go to some other place to find doctors. So.
For teleradiology,
is that that thing or some other thing?
Those are usually images on what are those things called? With the light and you put the X-ray on it. Yeah, I don't really think you can do that in rural areas unless the equipment exists there. But in terms of teleradiology in Africa to the rest of the world, one of the problems is the files are too big. So some physicians actually use their smartphones and they take a picture of the actual image and then just send the smartphone file because it's much smaller. But that results in reduced quality. So hopefully with faster internet, they could send the actual files and, you know.
So second part is you mentioned the money transfer system in Africa, like our online bank, right?
Yeah.
So my concern is if their network is not mature, so will
is
that
not what?
mature?
Metric. Oh, metric. Okay.
If our mature is not like here we have our mature network, so all the transaction will complete it successfully. But if in new term like in Africa, will some mistake happened, like the transition is done in incorrect way, or the money transfer to some other account, just like their network, their system is not good enough.
It's not. It's like it's kind of like PayPal. You have to load money onto the system first, and then you have credits. So it's not as good. Like, there will be problems with it, but it's still an improved system over physically handling cash.
So that's not quite the same as our.
It's
online
not. It's
bank,
not quite
right?
as good, but it's still good for a simple mobile phone.
Yeah.
Yeah.
This idea of internet access as a human right, and that connectivity is a really big thing that you have to have all the time. In Nepal, everybody has load sharing, and you get a schedule for when you'll have power and when you won't. And most people, at least at home, their internet is dependent upon whether they have power. And so they just plan their week. I'm not saying that it's good, but it's the way a lot of countries run. Where parts of the day you won't have power, you won't have internet, and you sort of save up the parts of your life that require power and internet for the times that you know that you'll have it. On the other hand, having a lethal chronic disease is not so easily managed as so I mean it's not really that statement from Bill Gates suggests it's a trade-off of one versus the other. It obviously isn't, but I think certainly human beings can survive quite well having only intermittent access, and I don't think it's a great violation of human rights. Sort of depends upon what the population comes to expect, what is normal in their culture. You can develop a kind of morality around the load sharing that you're not having power allows somebody else in the country to have it, when it's a scarce resource. Other questions?
I think we're kind of spoiled when we complain about our bandwidth restrictions and stuff, if you consider what you just said. So.
Yeah, that's right. You can be very proud of something you've created that's, like a video that's 4 to 6 gigabytes. You've created something that's completely impractical for a lot of people in the world to ever access. I mean, if you send them the file, they just couldn't use it. But you like it because it has high-res features. If you take something like that file that I showed you of the CBC interview when we were rescued on Signal Hill, I think that's only like 100 megabytes. It's greatly inferior to most videos that you see, but it's sort of good enough. You sort of got the idea, and that would then be practical for almost everybody to use, to access, to transfer. So we kind of get spoiled, and we have the feeling that unless we're capable of dealing with terabyte size storage capability and can readily deal with files of that size, there's something wrong with our lifestyle, but I don't really think so. Other questions?